2 months of work. And I yield to the gentleman from Colorado.
Thank you. Thank the gentleman from Minnesota. You alluded to other topics. I want to take this opportunity to remind our viewers that for the cost of the war in Iraq and Afghanistan, not only could we cover every American with health care, but we would reduce the deficit by hundreds of billions of dollars over 10 years. And I know that that's a topic that many of us plan to return to as well. But I would point out, to put things in perspective, there were those on the other side of the aisle that didn't ask, didn't worry how much it would cost to invade and occupy not one, two countries. Didn't ask how long it might cost to be there, 10 years, 20 years, how much to increase it, 40,000 troops, 60,000 troops, 80,000 troops. But there's a newfound commitment to fiscal responsibility when it comes to health care. And I'm proud to say that the Democratic plan fully pays for health care reform. Not only will it fully pay for health care reform, but it will reduce the budget deficit over 10 years and help rein in growing health care costs. I think it's important to put a human face on what health care reform means for American families. I want to share with my colleagues in the House the story of Deborah Abbott Brown from Boulder, Colorado. Deborah, like a lot of Americans, lost her job about a year ago in the recession. So she was faced with COBRA payments. Her COBRA payments would have been $1,800 a month to continue the health care for her family. She couldn't afford that. That was more than her mortgage payment. And at the same time, she was losing her income. How could she afford $1,800 a month in COBRA payments? So she wanted to turn to being responsible and wanting to keep her family with some kind of insurance. She turned to the individual insurance market in Colorado to try to find affordable coverage. She thought, you know, I'm willing to pay a reasonable amount, and maybe we'll have some kind of high deductible or catastrophic plan, but she soon found out that her family was denied coverage in the individual market, even though one of the companies they applied for was the same provider of the COBRA care that she couldn't afford. The reason is that her husband, Deborah's husband, had recently turned 50 and completed his first baseline colonoscopy, as was recommended by his physician, and he was told that the procedure counted as a surgery. And in the individual market, Aetna would not offer insurance to anybody who had a surgical procedure in the last 3 months. Deborah was shocked. How can a common preventative medical procedure, when there were no findings, be the basis for denying coverage? That's when it dawned on Deborah, as it's dawning on millions of Americans every day, that insurance companies work for their own profit. They unreasonably deny insurance in the individual market, and they don't provide needed insurance profits. That's when Deborah became a convert and asked us, that's why the public option is a must.
Yeah. Well,
this is a routine occurrence. Families across our country, California, Illinois, Minnesota, Texas, they want to do the right thing. She wanted to get COBRA for $1,800 a month. She said, let's find an affordable option. Oh, your husband had a routine preventative procedure that he should have had, and it was a good thing he had from a medical perspective. Came out clean, but you had a surgery in the last 3 months. This is what American families are being told, and this is what we in Congress have an historic opportunity to fix and to make a health care system that's good for American families. I yield back to the gentleman from Minnesota.
I thank the gentleman for yielding.